Hey everyone, and welcome to this explainer. If you're a biology student, you definitely know the visual, the iconic red cap with the white spots, right? But today, we're completely dismantling the folklore surrounding the world's most recognizable mushroom. We're going to uncover its actual, rigorous molecular pathways. Because what's happening at the receptor level when this thing is ingested is, well, it's entirely different from the pop culture myths you've probably heard.
So let's run through our agenda real quick. First, the serotonin psychedelic myth. Second, the GABA versus glutamate war. Third, the chemistry of drying and digestion. Fourth, the pharmacokinetics of reindeer urine. And finally, number 5, from lab tool to gummies. We're moving way past the fairy tales today to do a highly structured scientific investigation of its biochemistry and pharmacokinetics.
All right, part 1, the serotonin psychedelic myth. We've got to start by addressing a massive gap between public perception and neurochemical reality.
The scarlet cap studded with white warts is the visual shorthand for magic mushroom in cartoons, video games, and garden ornaments the world over, and almost everyone gets it wrong. It's universally misclassified in pop culture as a classic psychedelic. It's a super easy visual mistake to make, but as students of biology, we really need to look strictly at the pharmacology.
Because when you actually look at the receptors, the distinction is literally night and day. Classic psychedelics, things like psilocybin or LSD, those are serotonin 5-HT2A receptor agonists. They excite specific serotonergic circuits and produce cortical desynchronization, basically a loosening of the brain's ordinary rhythms. Agaric does the exact opposite. Its primary active compound, muscimol, has practically zero serotonergic activity. Instead, it forcefully drives the brain's primary inhibitory system. As a potent GABA-A agonist, it hyperpolarizes neurons and strongly inhibits action potentials, which, get this, actually produces cortical synchronization on an EEG.
So, the takeaway here? We have to reclassify it correctly. It is a GABA-ergic deliriant. The intoxication is not some lucid, ego-dissolving journey. It's a highly fluctuating, sleep-tinged delirium packed with vivid dreams. Nailing down this classification is absolutely crucial for understanding its true risks. Pharmacologically speaking, you should imagine it sitting on the shelf right next to alcohol or gabaxolol. Definitely not magic mushrooms.
Okay, moving to part 2, the GABA versus glutamate war. This is where it gets incredibly interesting, because there's a literal pharmacological tug-of-war happening right at the receptor level.
The mushroom isn't just delivering a single signal, it's delivering severely conflicting ones. On one side, we have muscimol. It's a structural analog of GABA. But unlike benzos that bind to an allosteric site, muscimol jams right into the GABA-A orthosteric pocket, the exact same pocket your endogenous GABA uses. It acts as a superagonist, specifically at extrasynaptic delta subunit receptors, throwing open those chloride channels and severely hyperpolarizing the neuron. But then, on the exact opposite side, we have ibotenic-acid. This is a glutamate analog. It binds to NMDA and glutamate receptors, completely flooding the neurons with calcium, which causes massive excitation and, if the dose is high enough, outright excitotoxicity.
Now, to put that into perspective, in a fresh mushroom, this isn't a fair fight at all. A single fresh cap is heavily skewed toward the excitotoxin. It holds roughly 9 times more ibotenic acid than muscimol. Because of this extreme imbalance, the resulting intoxication wildly waxes and wanes. A patient might alternate incredibly rapidly between severe, twitching agitation that's driven by the NMDA receptors and then swing straight into deep, comatose sedation driven by the GABA-A receptors.
Which brings us to part 3, the chemistry of drying and digestion. How in the world do traditional preparers manage this dangerous molecular imbalance without modern lab equipment?
Well, traditional drying is not just some old superstition, it is strict, verifiable chemistry. See, ibotenic acid is highly unstable. When it's exposed to gentle heat, drying, or even the highly acidic environment of the human stomach, it undergoes decarboxylation. It literally sheds a molecule of carbon dioxide. And this simple chemical reaction converts that harsh, excitotoxic ibotenic acid into the much more stable, brain-penetrant muscimol. So, drying the mushroom actively raises its usable potency while drastically cutting down the toxic load.
And hey, speaking of toxicity, we really need to correct another major myth. Out of a staggering 145,000 U.S. mushroom exposures reported over a 19-year period, shockingly, only 0.04% were fatal, and almost none of those involved Amanita Muscaria. Its lethal reputation? That's largely borrowed from its deadly cousins, like the death cap. Amanita Muscaria completely lacks those liver-destroying amatoxins. Now, it will make you sick. Severe nausea and vomiting are super common, but the real danger is additive central and respiratory depression.
That is especially true if someone combines it with other GABAergic substances like alcohol or benzodiazepines. Also, if you're planning on going into clinical work or research, note this: reflexively giving a patient atropine is a classic clinical error. Atropine only treats the peripheral effects of trace amounts of muscarine. It does absolutely nothing for the central GABA-A and NMDA syndrome we just talked about, and frankly, it can actually make your patient worse.
Let's move on to Part 4, the pharmacokinetics of reindeer urine. We are going to look at one of the most famous, seemingly bizarre pieces of biological lore through a strictly pharmacokinetic lens.
So why did Siberian shamans purposefully drink reindeer urine to experience the mushroom's effects? I know. It sounds totally made up, but as biology students, instead of just laughing it off, we need to ask, what is actually happening in the renal system here?
The crucial mechanism to understand is that both muscimol and ibotenic acid are excreted largely unchanged by the kidneys. The mammalian body essentially acts as a giant filter. By drinking the urine of a reindeer, or honestly, even another human who had consumed the mushroom, communities like the Koryak could practice what's called secondary intoxication. They were effectively recycling these unmetabolized molecules to extend a scarce resource, while the first host's body filtered out a lot of the harsher plant matter that causes nausea. It's totally bizarre, but pharmacokinetically, it is perfectly sound. But we do have to draw a hard line between real biology and absolute fairy tales. We have to separate the rigorously documented ethnographic history of Siberian shamanic use, which involves actual reindeer and real renal filtration, from romanticized fireside myths. Actually, you know that popular story that Santa Claus is just a secularized Agaric shaman in a red and white suit? Actual folklorists firmly reject that. His lineage comes from St. Nicholas and 19th century poems, not Siberian pharmacology.
All right, finally Part 5, from lab tool to gummies. Let's explore the stark contrast between how this mushroom is utilized in modern neuroscience versus how it's being exploited in modern commerce.
In a professional lab setting, muscimol is a highly precise, highly respected tool. Because of its incredibly potent GABA-A agonism, neuroscientists use it all the time to reversibly silence specific brain regions. You can inject it locally to temporarily just switch off a cluster of neurons without damaging the surrounding cellular architecture or any passing axons. Like, for example, a 2024 study in PNAS successfully used muscimol to inactivate specific neurons in the primate temporal lobe just to isolate their exact function and gaze behavior. That is what rigorous controlled biology looks like.
Yet, when you step outside the lab and look at the consumer gray market pushing muscimol gummies for sleep, anxiety, or focus, the clinical data completely vanishes. As a recent 2026 review in Frontiers in Pharmacology bluntly points out, these claims rest entirely on anecdotes. There are 0 completed human efficacy trials to back up any of these commercial health claims.
And honestly, the reality on store shelves is even more concerning. A 2024 CDC field report tested 5 brands of so-called Amanita gummies. 3 out of the 5 didn't just contain muscimol. They were secretly adulterated with Schedule 1 psilocybin and other completely undisclosed stimulants. The consumer market right now is basically a black box of unregulated chemistry.
Which has led us into a fascinating legal paradox. Amanita Muscaria is actually not a federally scheduled drug in the U.S. It's technically legal in 49 states, with Louisiana being the only exception. However, because of this chaotic market, the FDA finally stepped in using food safety regulations in late 2024. They officially declared the mushroom an unsafe, unapproved food additive. So while the mushroom itself isn't a controlled substance, selling it packaged up in a commercial gummy is now considered unlawful adulteration.
So, I'll leave you with this final, somewhat provocative thought. As future biologists and researchers, how on earth do we bridge this massive gap? We have a molecule that serves as a highly precise, brain-silencing tool in rigorous clinical neuroscience, yet society is somehow comfortable allowing it to be sold, totally unstandardized, on a random smoke shop shelf. Truly understanding the GABAergic pathways of Amanita Muscaria isn't just some abstract academic exercise. It's a necessary first step in demanding real scientific literacy in the commercial space. Thanks so much for joining me for this explainer, and remember to always keep questioning the science behind the folklore.